The agency I have been doing my practicum at is Mesilla Valley Hospice, which is located at 299 Montana Avenue here in Las Cruces, New Mexico. For 35 years, Mesilla Valley Hospice has provided comfort care and compassion to families throughout Doña Ana County. Mesilla Valley Hospice can provide service in the home, assisted living facilities, nursing homes, and at our hospice house. Their mission is to continue the legacy of comfort and compassionate care that the founders began. The original work of Mesilla Valley Hospice extends back to 1980. A small group of individuals got together and discussed the hospice concept, and the group believed there was an immediate need to provide terminally ill patients with an alternative in end of life care. The founder is Dr. Terry Meyer. It was intuitively convinced the hospice philosophy would be a valuable addition to the scientific support available to dying patients. Community support for hospice programs was evident from the beginning, and furniture and items that were needed to set up were donated, and a venture and mission grant from St. Andrew's Episcopal Church established Mesilla Valley Hospice as a viable program. In 1983, Mesilla Valley Hospice was accepted in the United Way program. The board of directors worked for many years to establish a hospice house, but it wasn't until three local doctors donated 5 acres of land. Following the gift from Doctors Duarte, Fleming, and Pusalik and their families, the community raised over $1.3 million, and Mesilla Valley's Much More Can Be Done capital campaign. La Posada, the first freestanding residential hospice house of its kind in the state of New Mexico, opened to its first resident in September of 1998. A second wing to La Posada was constructed in 2003 following a $1 million capital campaign. Doctors Duarte and Pusalik donated another 1 acre tract that adjoined the existing hospice facility. Um, it kicked off in 2006. The Continuing the Dream campaign allowed the completion of the original master plan for the Mesilla Valley Hospice campus and added a third wing to the Posada, a chapel, the construction of a home care center for our home care staff, and the landscaping of our 6 acre campus. The Center for Grief Services was also added in 1999 and became available to everyone in our community who has experienced loss, regardless whether the person was a hospice patient. We continue to provide free grief support to anyone in our county who needs it through both individual counseling and group counseling sessions. Services are available to both adults, children, and can be provided in Spanish. We also work closely with our local schools to provide grief support to those children that schools identify as needing assistance. Hospice focuses on caring, not curing, and in most cases, care is provided in the patient's home. Hospice care is also provided in freestanding hospice centers, hospitals, nursing homes, and other long-term care facilities. Hospice services are available to patients of any age, religion, race, or illness. Hospice care is covered under Medicare, Medicaid, most private insurance plans, HMOs, and other managed care organizations. Whether a patient is eligible for hospice benefits may vary depending on who is covering the cost of care. Currently, most hospice care in the United States is covered by the Medicare hospice benefit, which requires patients to be diagnosed with a terminal illness, be 65 years or older, have the patient's doctor and hospice medical director certify that the patient has 6 months or less to live. Many other hospice benefit programs also follow these same guidelines set by Medicare. Patients with a terminal illness do not usually have to pay for hospice care. Most hospice care benefits are covered by Medicare or through the hospice benefit. The Veterans Health Administration. Currently, most hospice patients have their costs covered by Medicare or through the hospice care benefit. Medicaid provides benefits that are very similar to Medicare hospice benefits. The VA hospice benefit works the same as the Medicare hospice benefit. It includes hospice care provided on a per day basis. Hospice coverage includes interdisciplinary team, which is a doctor, registered nurse, social worker, certified nurse assistant, chaplain, bereavement counselor, and volunteers. Pharmaceuticals, related to the primary diagnosis, medical supplies, and durable medical equipment, which could be wheelchair, walker, electric bed. Types of microclinical practice. As social workers, we help both patients and their families navigate the difficult process of end of life planning, manage the mental, emotional, familial, and monetary stressors of debilitating physical illnesses. We understand their treatment plan and we are vocal about their needs to overcome crisis situations and to connect other support services in the area. We are advocates for the patients and their families, and we try to possess a deep knowledge of what the clients need and what resources are available within and outside of the hospice setting. Types of meso community practice. Care coordination is defined as the delivery of effective medical, psychological, or social care through the organization of primary and secondary care providers. With this knowledge of systems of care and support, both within medical settings and the larger community, hospice and palliative care social workers are often the point of contact between different care providers, as well as the liaison between clients and their treatment team. Macro policy education. Despite growing acceptance that patient engagement and shared decision making should be goals of medicine, organizational attempts to support these ideals are limited, and larger institutional structures often constrain patient autonomy. Home hospice care is a subset of medical care that has consciously developed a philosophical and practical approach to encouraging patient and family engagement. Social work theories that influence practice at hospice and palliative care. We provide emotional support, counseling, psychotherapy to patients and their families who are experiencing psychological and emotional difficulties in the face of terminal or debilitating illnesses. We employ a combination of clinical social work modalities to help the clients evaluate and manage their thoughts and emotions, as well as overcome various behavioral changes. Some examples of the modalities may use their work with clients are mindfulness-based stress reduction, cognitive therapy, dialectical behavioral therapy, supportive psychotherapy, expressive arts therapy, and storytelling therapies. Types of evidence-based or practice-based interventions. At hospice, we must be prepared to intervene and provide emergency psychological support when clients and their loved ones are experiencing mental, emotional, or familiar crisis. Crises are usually events that cause a degree of distress that exceeds an individual's capacity to cope. In short term, qualifying events vary from client to client, but they can include the unexpected advancement of a particular condition, traumatic family conflicts, instances of physical violence, neglect, or verbal abuse that result in trauma or the development of suicide desires in a client. Competency one, demonstrate ethical and professional behavior. At Mesilla Valley Hospice, ethical and professional behavior from all staff, clients, students, and volunteers, and opportunities in demonstrating ethical and professional behavior by practicing confidentiality. I am knowledgeable about and compliant with HIPAA and EMR PHI protective practices. I am being trained how to articulate key social work and end of life ethical principles and practice related to professional integrity in case discussion. Competency two, we work with many clients at Mesilla Valley Hospice that come from different cultures, immigration statuses, socioeconomic backgrounds, and religious beliefs. We comply with the applicable federal civil rights law that does not discriminate on the basis of race, color, national origin, age, disability, or sex. Nobody is treated different. And a result of practicing this competency is understanding the values and beliefs and understanding clients' different customs as well as their families. Competency three. Mesilla Valley Hospice offers care to anyone in need, including people who do not have the economic status to pay for their treatments. To understanding that many people from different backgrounds have health issues and socioeconomic statuses, everyone deserves to obtain medical services and die in peace, regardless of class, race, or status. Mesilla Valley Hospice recognizes that many of our clients have inadequate living standards, and we try to help them move into our assisted living facility or offer home care services to guide the patient and their families. Competency 4, engage in practice-informed research. This competency is relevant in my current practicum because all social workers, we are working with the clients facing acute or long-term situations involving life-limiting illnesses, dying, death, grief, and bereavement. By using previous experiences when meeting and counseling clients, I will be able to observe the many barriers that are brought upon our clients, such as religious, cultural, emotional, legal, and policy areas. Research previous methods that I have used that have not worked in the past and employ evidence based interventions to help clients and their families through their end of life process. Competency 5, the federal role in hospice care began in 1982 and was permanent in 1986 by the Medicare Hospice Benefit Amendment to the Social Security Act. This law defines hospice care and the extent to which a patient must be terminally ill in order to qualify for services. In addition to federal minimum standards for hospice care, which are monitored through a survey and certification process, national organizations have also developed hospice standards, accreditations, guidelines, credentials, and certifications for both programs and hospice professionals. We use policies and guidance how to effectively help current and future patients with their Medicare coverage. In addition, we also use policies that tell us which patients qualify to receive hospice services and which patients can actually graduate and go home to assisted living facilities or their private home. Competency 6, cultural humility encourages an active participation in order to learn about the patient's or client's personal cultural experience. I am constantly learning to apply knowledge of human behavior and social environment, person and environment, and other multidisciplinary theoretical frameworks to engage with clients on many different levels. I want the clients to know that I am ready and willing to learn new things about their culture and beliefs in order to guide them in the right direction. Competency 7, working in a hospice setting, there is ongoing assessments of medication intake, side effects, and family dynamics. Hospice and palliative care services offer medical care, pain management services, as well as psychological, emotional, social, and spiritual support to the clients and their families um, who are from all different backgrounds and are suffering from debilitating conditions or terminal illnesses. This allows me to engage in the interactive process of social work practice with and behalf of diverse individuals, families, and groups. Competency 8, use the information gathered to conduct risk assessments, which are specialized assessments aimed at determining the likelihood that a patient will experience a severely negative outcome. I understand methods of assessment with diverse clients and constituencies to advance practice effectiveness. At my practicum, we are constantly evaluating different situations and possibilities to understand the needs of our clients. Competency 9, at Mississauga Valley Hospice, cultural humility is used as a process of self-reflection and discovery in order to build honest and trustworthy relationships. When working with clients who are receiving end-of-life or palliative care, it's very important to build rapport with clients. Working with clients with terminal illnesses, death, and dying are universal experiences. The way people understand and respond to them are shaped by the attitudes and beliefs of their particular culture. I have really enjoyed doing my practicum at Mississauga Valley Hospice. I am continuing to grow and learn, and here are my references. Thank you.